So right now we're in the open enrollment period for Affordable Care Plans. It started November 1st and it goes until December 15th. If you're listening to this outside of the open enrollment, if you have a qualifying event such as a job loss or a change in health insurance, then you could also qualify to enroll outside of that open enrollment period.
Are you ready for a successful retirement? We're addressing the topics facing today's retirees. Welcome to Retire with Ryan. Now here's your host, Ryan Morrissey.
Welcome back. Last week, I talked about what you should do if you're in the unfortunate position of being laid off. And along those lines, I wanted to talk about getting health insurance before age 65 and what your options are for that. If you listen to last week's episode, I talked a little bit about those options as far as getting health insurance during a layoff, but I wanted to expand upon that. And if you've checked out my blog posts in the past, I do have a blog post from a few years back titled this exact thing, Health Insurance Coverage Before Age 65. And I wanted to update that a little bit and remind you of what those options are in case you haven't seen that. So if you're in the situation where you're thinking about retiring before 65 or you happen to get laid off before 65, and why is 65 important? Well, at 65, you're now eligible for Medicare. And for many people, that solves a lot of issues as far as planning for health insurance. So let's go through and talk about what those options are that if you're trying to get health insurance coverage before you're eligible for Medicare. So you have 4, potentially 5 options if you find yourself needing health insurance before 65. Option number 1, you could choose to have no health insurance. Believe it or not, there was a penalty a few years ago where if you didn't have health insurance, you'd have to pay a penalty. And for many people, that penalty was more than the cost of actually getting health insurance. So that forced a lot of people to get health insurance, but that penalty actually went away a few years ago. So you could make the decision to not have health insurance. Obviously, you're taking on a lot of potential financial risk because if you happen to have an accident or an illness come about and you've worked really hard and saved up a lot of money for retirement, a lot of that could be wiped out pretty quickly with medical bills and hospital bills. But if you don't have any assets, then that could be an option for you. But that brings me to option number 2. And for certain individuals with very low income, you could qualify for your state's version of Medicaid. In Connecticut, it's called Husky. And generally, this is for people that have minor children and are in need of care. But for a single individual without minor children under 65, if your income is under $17,609, you could potentially qualify for this. Or as a married couple, if your income's under $23,791, you could qualify for this. I'll put a link in the show notes because this is based on the family size. And for many of you, this is probably not going to be the situation, but in a dire case where you didn't have any income or minimal income, this could potentially be an option for you. And that leads us to option number 3. And that would be to continue your existing health insurance that you had prior to your retirement or prior to your layoff. This is also known as COBRA insurance. And you would pay the full amount that your employer was paying for this health insurance. And in many instances, a benefit of working for a company is that your employer is paying a large portion of your actual premium and you're just responsible for the difference. So let's just say you're only paying $100 a month for your health insurance when in fact the actual cost was $750 a month. So you'd be paying that full $750 a month plus a 2% premium. That is the additional charge that you pay. And you'd want to check with your employer to find out what the full cost of his health insurance is. Many times you'll get some information from your employer, severance package or information about your benefits after retirement or a layoff. And there'll be information where you can reach out and find out what the cost of that is and can keep this up to 18 months. So this could potentially help you bridge the gap to age 65, right? If you retire at 63 and a half, well, you're perfect because that would get you to age 65. But if you're trying to retire at 60 or you find yourself laid off at 60, well, obviously that's only going to cover you for a year and a half, and you're going to have to come up with health insurance for the remaining 3.5 years until you're eligible. So I would say this is a good option if you've already met your deductible for the year on your health plan, or if you're close to meeting it. This is a good way to get you towards the end of the year. And then before the year is up, you'd want to investigate whether or not you want to continue to keep this COBRA health insurance, or you want to pursue one of the next two options. So option number 4 would be to investigate the individual plans that are available in your home state or the state that you're going to be living in for the preceding year. So in my home state of Connecticut, unfortunately, there's only 2 companies offering individual health insurance, and that's Connecticut or Anthem. And these premiums can be quite expensive. Your home state might offer you more options than mine. And as I said before, if you're planning to move to another state, then you'd want to investigate those plans available in that state. Other states have more health plans, and you'd want to get an idea of what the deductible would be, what the insurance premium monthly amount would be, to get some feeling of what's appropriate for you. If your health wasn't good, you'd probably want to select a plan with a lower deductible. If your health is good, then you'd probably want to go for a higher deductible plan. And one of the other things that I talked about in episode 1 regarding health savings accounts is that in many instances, when you go from having employer health insurance to individual, your deductible goes up. Many employer plans still qualify as a high deductible plan, which would now qualify you for a health savings account. But if it didn't, this is an additional benefit for you because now you could be allocating some of your income or moving some of your additional assets over to a health savings plan that could come in handy as far as giving you a deduction and also giving you the ability to take this money out for health-related costs either now or in the future. So I would check that episode out if you haven't. If you're interested in getting individual plan quotes, you can either reach out to the company directly or you can find an independent agent for that. So that brings us to option number 5, which is purchasing an individual health insurance plan through the Affordable Care Act, or otherwise known as Obamacare. And this is a way that you could significantly reduce your out-of-pocket cost over option 3 or option 4, such as COBRA or getting your own individual plan, provided that you qualify for the subsidy. A number of states have elected to create their own website or online marketplace where you can go and you can get estimates of what health insurance costs would be and look at the different plans. And those states are California, Colorado, Connecticut, the District of Columbia, Idaho, Maryland, Massachusetts, Minnesota, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, and Washington. All the states that I didn't mention, there's a national website that you would go to, and I'll put a link to that show notes, but that's healthcare.gov. Any of those other states I mentioned, you'd go to that state's website. You could easily look that up by typing into Google, for example, Connecticut Healthcare Exchange, and the website in Connecticut is accesshealthct.com. And once you go to that website, there's a lot of information on there. But if you're looking to get a quote, what you would first click on is compare plans. You don't have to sign in. And that brings you to a screen where it asks information about your situation, such as the county that you live in, the age, and the coverage year that you're looking for, as well as, so you'll be looking for next year, I'd presume. And you also have information to enter anyone else in your household who's going to need coverage. And if you're married, obviously this would be your spouse. If you have any dependents living with you, then you'd add them as well. And then next it asks for your total household income. And this is where it's very important that you estimate that. And just to the right of that box is a little question mark, which if you click on it, it tells you what they're referring to as far as income. And what they're talking about is your modified adjusted income. That's different than your adjusted gross income. There are several ways, depending on what you're using your modified adjusted gross income for, that you actually calculate it. But it does talk about some of the things that are included, such as any employment income that you are receiving, any unemployment income, alimony that you would be eligible to receive. any interest that you receive from your investments, any Social Security benefits, any dividends, any real estate rental income, any tax refunds or credits. So it's important that you have an idea of what your modified adjusted gross income is. But however, there are things that you can actually subtract from this, such as any IRA contributions that you make, health savings contributions that you could make, 401k contributions that you could make. So there are a number of deductions that you could take to reduce your modified adjusted gross income. And why this number is important is that depending on what this is in your household size determines what type of subsidy that you actually could qualify for. This modified adjusted gross income limit is a function of the federal poverty level and is 400% of that number based on the size of your household. The larger your household size, the larger your modified adjusted gross income could be to qualify for this subsidy. So the numbers for next year are, if you're a single individual, your modified adjusted gross income would have to be under $51,040. Once it goes $1 over that, you no longer qualify for a subsidy. And the lower your income is underneath that level, the higher the subsidy that you qualify for. If you're a married couple, your modified adjusted gross income would have to be under $68,960. And if you happen to have a dependent, if you're a family of 3, your modified adjusted gross income would have to be under $86,880. And let's just say you have 2 dependents and you're a family of 4, then your modified adjusted gross income would have to be under $104,800. So let's just focus on a couple and talk about some real life dollars here as far as what that subsidy is and how it could help you. So as I mentioned before, you have to stay underneath that level. So it's $68,960 for next year. Once you go $1 over, as I said, you completely lose your subsidy. So to run a quote, if your home state has their own healthcare exchange, you'd go to that website. Or if your state doesn't have an exchange, then you'd go to the national website to get a quote. I'm going to post a link in the show notes of a YouTube video of actually using the Connecticut website so that you can see how to run the quotes and how to adjust your information. I ran a quote for a hypothetical 63-year-old and 64-year-old Connecticut resident living in New Haven County, assuming modified adjusted gross income of $70,000 for next year. For a husband and a wife, the monthly premium would be $1,695 per month, and that would be for the highest deductible plan offered, which is a $14,000 deductible. So that's quite a bit of money for the highest plan. There's other plan options here with a lower deductible, but the premium is going up even more. And the lowest deductible you'd see is $2,600 annual deductible, but that monthly premium would be $46.13 a month. There's also a $7,000 deductible, which is $2,807 a month. Those are very, very large amounts. Obviously, you'd still have to meet your deductible before you'd get a lot out of the plan. Many of these plans do cover some visits as far as for a routine physical primary care visit reduction, where you really would only be meeting the deductible if you ended up needing some type of surgery or had a prolonged hospital stay from an illness or an accident. If I now assume the same couple's modified adjusted gross income next year goes down to $65,000, the monthly premium for the $14,000 deductible plan goes down to $2.11 per month. So that's what I was talking about, where it makes a massive difference. You're talking about savings of $1,693 per month in premium. And that money you could set aside to actually use to pay for any out-of-pocket costs you might have or to help meet your deductible. And if you didn't feel comfortable with that high of a deductible, there are other options, whereas you could find, there's one plan here shown that your deductible would be $4,000 annual deductible and your monthly premium would be $321 a month. You can also play around with your income to see if it was lower than that amount, how that could also change the premium as well. So you'd want to look into all the details of these plans. And you could also call, there's a 1-800 number where you could call and talk to someone who'd be more knowledgeable about the plans and maybe the plan that would be more appropriate for you. or you could also reach out to an independent insurance agent who deals with healthcare plans both on the exchange and off the exchange to get their opinion and feedback about what might be appropriate for you. Now, this plan may or may not cover dental and vision, so you might want to get a supplemental dental and vision plan as well. So right now, we're in the open enrollment period for affordable care plans. It started November 1st and it goes until December 15th. If you're listening to this outside of the open enrollment, if you have a qualifying event such as a job loss or a change in health insurance, then you could also qualify to enroll outside of that open enrollment period. If you're thinking about these plans for next year, either switching to one or you're in a situation where you've been laid off, make sure that you enroll in the plan before December 15th so that it will be effective for January 1. And if you're planning to qualify or try to qualify for the subsidy, think about where your income is going to come from. And if you have money in cash or savings, you could use that or live off of that for a number of years. If you have retirement accounts, you could also take money out of them, but keep in mind that every dollar you take out of a retirement account counts towards modified adjusted gross income. So maybe some type of splitting strategy where you take a certain amount out of your IRAs or 401ks, plus taking some money out of savings so that you have enough income coming in, but you don't go over the individual or the joint modified adjusted gross income limit to lose your subsidy. Another option is that before next year, if you have all of your money right now in retirement accounts and none of it is in checking or savings or not enough for you to live off of for however long until you turn 65, maybe you take out a larger distribution this year to give yourself a couple years of income set aside in a non-retirement account. Even though you might pay some more taxes by doing that this year, premium savings on the subsidy that you could get next year could significantly outweigh the additional tax that you might pay. So that is something you'd want to do before the end of next year. So there are a number of planning strategies that you can use to qualify for the subsidy, depending on where your investments are located or the different types of investment accounts that you have. You just need to think about this at least a year in advance, if not a few years in advance, to optimize your situation to qualify for the subsidy. I hope you found this episode beneficial on your healthcare options before age 65. I hope you have a wonderful week, and I look forward to talking to you next Wednesday. Take care.
You should consult a financial advisor familiar with your specific circumstances before you make any financial decisions. Nothing in this broadcast constitutes a solicitation for the sale or purchase of any securities. Any mention of rates of return are historical or hypothetical in nature and are not a guarantee of future returns. Ryan Morrissey, CFP, is an investment advisor representative of Morrissey Wealth Management, LLC, a registered investment advisor.